Gabrielle. So it's been a couple weeks since I saw you last time. Can you tell me a little bit about how you felt right after the massage and how you're feeling now?
Okay, so when I came in a couple of weeks ago and got a massage on my hands, it felt very relieving, instant relief. Usually, if like my hands tense up and they get really like tingly, and I feel like they sometimes lock up with my fingers. And after the massage, I felt like you just kind of like literally released everything, and it felt better for like a solid week and a half.
That's awesome.
And now that it's been a little bit and it's starting to feel like it needs it again.
Right.
So,
Yeah.
yeah, definitely it helps out a lot.
Awesome.
Just trying to break up, I guess, is it the nerves or muscles?
So it's the myofascia. It's the connective tissue that kind of surrounds and supports lots of different structures in your body. But the fascia is the general term for that, and myofascia is the muscular form of connective tissue. So, like we were talking about last time, you have this sort of like ace bandage underneath your skin. The structure is called the retinaculum, and it supports and surrounds all the bones and nerves in your wrists. So what happens is that myofascia gets tight and it like pulls your hand closed.
Inward.
Right,
Yes.
exactly. And so what we did last time was work on opening all that
exactly doing so crazy. I was just at a sushi date with my son last week, and I couldn't
You couldn't use the chopsticks, yeah.
Oh my gosh.
Yeah.
And I felt silly because, you could use a fork anyways, but it's not proper. And
Yeah,
I wanted
right.
to use chopsticks.
Exactly, yeah.
It was hard.
Yeah.
But, no, even after doing the massage, a couple of days later, me and my husband went for a sushi day, and I was able, to eat properly.
Oh,
but
that's
just
great.
last week, me and my son went. My birthday was a few days ago, so we kind of celebrated it and went for a sushi date. And yeah, using chopsticks was not happening.
Right.
At all.
Well,
So
hopefully we'll get you using chopsticks again.
Thank
yeah.
you. Yeah, no, definitely. So.
All right, sounds good. Is there a particular wrist that is bothering you more right now?
Yes, my right, for sure.
So I'm going to start with our aromatherapy. Would you like to do the lavender, citrus, or the relaxation one?
Citrus, please.
Just take a deep breath in. One more big deep breath. Let's roll on here. Your extensors have really tightened up since the last time I saw you.
It's like within like a week. Really good. Like the next day, I'll feel like $1 million.
Right. We went out. We spaced your appointments a little bit too far apart. Yeah, because we had to reschedule and things.
Yeah.
But as we keep working together, basically what I always recommend is that we do it once a week for 3 weeks, then we can go down to every other week, and then like once a month for maintenance. So what happened was that we lost the progress that we made.
Yeah.
So we're kind of starting. This is basically our first session all over again. But as we kind of work together, it's going to really like start to permanently loosen up that myofascia.
Oh.
Yeah. So I can feel all right right in here. These muscles here are kind of like the puppet master, and then they control your fingers, which are the puppets.
Yep,
right?
definitely. I could feel it in my fingers.
Right, and a lot of times when I'm working on this, I'll like see the little fingers jump down here. And particularly when we work the flexors on the opposite side, a lot of times you'll see the fingers like pull down.
Yeah.
Okay, so we're gonna come in with some deep and specific pressure right on top of here. I just want you to let me know right when that pressure's perfect for you. It should be that kind of like hurt so good feeling. Take it close. You need a little bit less or more. That's good. Just okay, I already feel a little bit of softening right in here. Much more pliable. The same thing, we're just going to do this on 3 different points here. Just lay down and feel the pressure. You feel like you need a little bit more than that? Or is it okay? Feel a little tingles?
Oh yeah.
Yeah.
I feel like there's like a release in my fingers.
Yeah. So what you're feeling is that we've decompressed the nerve here, so
Yeah.
you're getting regaining some sensation in your fingertips. Pressure's okay? So much more movement.
Do you feel like how kind of hot my hand is?
Mm-hmm.
Like it feels like it's gonna explode.
You alright?
No, it's fine. It just feels like it's like inflamed
Yeah.
from over the couple weeks. you
Yeah,
know?
yeah. And that'll happen, you know, it's just inflammation in your system. And as massage always increases circulation, so as we're working on you, you're gonna see more blood flow coming to the hand, so that might also feel hot. Pushers are bigger?
Mm-hmm.
Any more than that, or is that good?
That's good.
Okay, so that's feeling a little bit looser now. So now we're gonna work on the flexors, so just on the opposite side of the forearm. So you can see what I was saying. As we pull down, her fingers are gonna curl a little bit. And especially like right at the middle here. That pressure's okay? Comfortable?
Very good. Right towards the elbow, I can feel that.
Feels a little tender?
Yeah.
Or, yeah. I can feel these muscles are like really kind of glued down, so I'm just trying to get a little space in there by pulling up. So we're gonna come down with some deep pressure here. Just let me know when. still some adhesion right here. I'm just gonna come in here with fingers. So the pressure's good. Need more than that, or is that enough? Okay. Feeling pretty good to me. Would you agree?
Yes.
So now, this is really where the problem comes from. So this structure right in here, the red macula, kind of looks like an ace bandage underneath the skin. So you can imagine there's like a web of connective tissue that runs from here to right about here, and it's just really, really tight and pulling those bones into that tunnel like we talked about.
Yeah.
And I can even feel, like, as I'm running over the carpals here, that, like, they're out of alignment because they move in a pretty characteristic way. And so by pulling on the skin with just a tiny bit of oil on, I'm able to get some traction and get some movement. And so I'm going to take a little bit of slack into the wrist and pin that down and stretch it. Pop there.
Mm-hmm.
Not a chiropractor, but sometimes the bones like to move on their own.
I feel it pulling.
Yeah. Does it feel good?
Yeah.
Yeah. It's just stretching that structure out. So now we're going to do the same thing on the underside. Just be really passive. I'm going to come in here. I felt a little pop there. Now that I'm in here, I can feel that there's still some tension right in this little flexor right here. So I'm going to come in again with some deeper pressure and just find the trigger point that's along this belly.
Okay.
Okay, right in there. Just let me know when that pressure's good for you. Just be really passive. Let your hand relax. There you go. Pressure's good. Need a little bit more or less. Good. Nice slow deep breaths for me. That feels better. That's what we were doing. It's kind of a weird motion. Come over this way, and then we're going to come in that way. Lay down on the table here, just going to check what's going on. How's that feeling?
Very relaxed.
Awesome. So now we're going to do a little bit of a technique called skin rolling.
Okay.
And I'm just basically going to pinch your skin and make a little wave. And it's going to go all the way around your wrist. Yeah, I can feel there's some restriction still in that underside. So I'm going to do a little bit more.
That's where it feels the most.
Yeah. your palm is restricted too. It doesn't open as much as it should. Overall, how's that feeling? Good. Okay, so I'm going to take you through a little bit of range of motion. I just want you to tell me if you feel any restriction. Okay, so kind of bring your hand up a little bit and like rotate your wrist around. Anywhere it feels caught, stuck, uncomfortable. No? Feeling good?
Like through. Yeah, that's because that's
pulling
a
down
normal
that way.
feeling, but
Where do you
pressure.
feel that? Like in here?
Yeah.
You can be passive, I got you. Okay, let's give her a roll, see what that's doing. A little better?
Yeah.
Okay. Clicky poppy. Alright. Okay, and then just give me a finger extension, nice and as open as you can, and close. Anything feel stuck, caught, uncomfortable when you're doing that?
Like
In the palm.
really, but
Yeah, so we can do a little bit of stretching for that.
it's always been troublesome for me to extend my hand fully without it hurting so bad.
We're going to do finger by finger, nice and passive. Give me your hands. Okay. There you go. It's okay.
Probably just the end.
No, it's all good. Is that a comfortable stretch?
So
Okay. And you feel like you could take a little bit more, or is that enough? Okay. I'm going to bring your wrist down a little bit and kind of take the fingers just a little further back. Feeling comfy?
Okay.
Not overstretched? We're going to gain fingers as we go here. Comfy? Passive, passive. There you go. Remember to breathe, nice deep breaths. Give a little bit of nicey nice on the hand here. Alright, one more range of motion. Give her a wrist roll. Open, close those fingers. Feeling nice and loose?
Yeah.
Awesome. Okay. Okay. So we're going to do a little bit of cupping now. So what cupping is we use these little silicone cups like this, and they draw the skin and muscle up into them. So you can see it's like grab onto my skin there. And it's going to basically do the inverse of massage. So with massage, we're pushing pressure down, and we are using that pressure to kind of break up adhesions and bring circulation to the area. Cupping has a lot of the same benefits. It's just the difference is that it's vacuum, so you're getting negative pressure rather than positive pressure. So yeah. Cupping is awesome for people who can't take a lot of pressure. And it's also really good for myofascial restrictions, which is what the carpal tunnel syndrome is. So it does need a little bit more oil than the type of massage I was doing before. And so we're going to use this kind of bigger cup on the forearm. What does that feel like? A little tickly?
Yeah.
Yeah. So do you feel that stretch?
I feel it pulling.
Yeah.
Yeah, for sure.
Yeah. And so we're going to do it a little bit lower here too. So the cool thing about cupping is that a lot of times it works faster than the type of massage that I was doing over there with like the trigger point and myofascial techniques combined. And there's a couple different ways that we do it. We can do it stationary, or we can use glide cupping. So here at the Deep Tissue Spa, we use more glide cupping or myofascial cupping. And so we're not going to leave those like deep purple marks that you see on some people when they go for cupping. That's traditional Chinese medicine, where we do kind of more modern cupping techniques. And so the same idea, I'm going along those extensor muscles. And these little marks are going to fade. Yeah, you feel it?
Oh, yeah.
Yeah, it's pretty instantaneous. And so sometimes we do like a combination of the cupping and the massage work, but it kind of makes our job a little bit easier. And it's a lot more comfortable for the client, particularly if you don't like the sensation of like really deep work. So still some restriction in this one here, so we're going to come a little bit. Doesn't want to stay on. Just with that much, it's about as loose as the 2 or 3 minutes that I spent doing that deep trigger work on the other side. I do still feel like we need to kind of get some deep pressure right on this one. So just let me know. Okay, nice deep breaths. Just felt that. That was a big release. This way for me. Felt like when I just by circumstance kind of moved your hand like that, I felt a release happen just like by accident almost. I'm just kind of checking the tension. Because as that tissue loosens up, it'll be much easier for me to move the cup. Yeah, so we get a little bit of movement there now. And that little flushing of your skin is totally normal. Cupping can leave marks on you, but they should clear up in like 5 to 10 days. And we don't do the type that's gonna like really, really bruise you. You might get little like almost hickey looking marks. It's not the goal, it's just incidental. Bringing all kinds of nice new blood supply to that area. Yeah. So what do you say you prefer so far? Do you like the massage or the cupping?
I like the cupping.
Yeah.
I like how you intensify with the cupping, but then you go in with the massage and you just even
And so the cool thing with cupping too is that these structures that are a little bit harder for me to access, I can really get into with the cups. I'm gonna have you bring this down on the table for me. So can't really move that from there. Just the shape of the hand won't allow it to glide and stuff. But it's just I'm gonna leave it on there to bake for a little bit. I can't really put deep pressure right over those carpals just because it would be painful and it won't do anything. Yeah. Cupping is also really, really great over the spine, which is like an area that we can't normally directly work on, so it's just great anywhere that like there's a lot of bones or connective tissue that we can't really dive deep into. So I can already feel that's much looser, like just from that one, little 30-second hold we did on it. And here's the other cool thing is like on the like directly on the palm we can do. It's like do what I want it to. Just hold still for me. Okay, open up your palm. It's nice and secure. And so again, we're just going to let that sit for a little bit. What does it feel like on your palm?
It's like pulling, it's like a little bit, tingling a little bit in the inside of the cup, but it's taking the tingling out of my fingers.
Yeah, you feel that like pull.
It's pulling like the pressure all into the cup.
Yeah, that's cool. Feeling a lot better. I'm going to focus a little bit more on this part of the palm now. So I'm going to open that palm up from here. You can relax it. Feel secure? Not quite? Okay. Oh, it's not even on there. It's a little tricky to get it just right. There you go. I'll just do a little bit of manual work here. It did loosen up even just with that much. Do a little range of motion test. Your eyes roll around. How's that feeling?
Good.
Catching, clicking, popping, uncomfortable anywhere? No? Look like
kind of like, I guess like
more in that.
Yeah. A little flow.
Yeah. We can work on that. So I did feel that like in this little part of the hand here is called the thenar eminence, and I could feel that there was a little trigger point like right there.
Yep.
And just let your hand be passive. Fall down on the table for me. Yeah, there you go. Pressure's okay?
Oh yeah.
You need more than that, or is that good?
That's good.
How's that feel? Better?
Oh yeah.
All right. Okay. Do you want me to do anything else on that arm for you? Or you feel like you're good? Okay.
Yeah.
All right. Okay. Well, we're gonna go ahead and step out. And so, how you feeling?
Relieved.
Yeah.
I can use my hands.
That's
No
awesome.
tingles.
Yay.
Everything feels great. The cupping is like amazing. That was nice.
Yeah.
Just
So.
the pressure and then the pulling away from the pressure was what like helped a lot.
Yeah.
So.
Yeah, and you felt like it, like you could feel the change happening.
Oh, for sure.
Yeah.
Yeah, even just massaging because this is my worst hand. when they did the electronic shocks in my hand,
Mm-hmm.
it showed that this had more of the carpal tunnel
Mm-hmm.
in my wrist. But
Yeah.
when you go in here and you could hear the clicking of
The
it
bones.
coming out,
Yeah.
and the bones and everything.
Right.
It's. I feel like it would be more a relief if I did this versus going to a surgery.
Yeah.
I'm supposed to be doing surgery next week, and kind of want to maybe not do it.
Postpone it a little bit at least.
Just to see if this
and
works
see,
a
yeah.
little bit, more. And one, it might be, cheaper. Two, it might help better, and it's more of a natural feeling versus having to go through therapy and
recovery
medicine
and
stuff like that. So
yeah,
this is something I might have to think
I
about
mean,
doing.
you could definitely, postpone it, and a lot of times we can postpone the surgery for several years and sometimes, just altogether, because massage is one of the most effective treatments. Like, this is a condition that massage treats very, very well, and we have a lot of success with it,
And a lot of times, from what I've heard from people, I've heard from so many, because I work in a restaurant, so of course I'm constantly, not only, talking to people, but also using my hands every which way I need to. And I talk to guests all the time, and they tell me that they've had carpal tunnel surgery or carpal tunnel before, but they did this and now they're fine, or they use just their braces. And I'm like, okay, well, I use my braces, but I still get inflammation out of nowhere.
Absolutely.
I'll be good, and then all of a sudden I can't use my hands for 3 days.
Right. Yeah.
So but with this, it's like I can walk out of here and I can be a juggler and have trays in my hand and not have to worry anything.
And go have some sushi, hey?
Yeah, have some sushi. I'll be able to hold my chopsticks.
Yay!
Yeah.
All right. Well, I'm looking forward to our next session, and keep
cool.
us posted on how you're feeling in between now and then, okay?
I will.
All
Thank
right.
you.
Thanks.